My name's Joanne, and I just wanted to first say thank you to everyone in the primary care practices who have come on board. You've been amazing. We currently have 19 primary care practices in Southwestern Public Health interested. 16 of those are up and going and administering doses in arms, so congratulations. 2 are in the process of getting doses in arms, just haven't quite yet, but hopefully by the end of this week. And then 2 are just starting the process. So that is wonderful. Thank you all. I'm going to quickly just run through a couple of slides that I was asked to present. Hopefully it's a valuable information. Some of it I'm sure will be a review for most of you. A few of the things were things I found as I've come out to do the public health portion in offices, which Dr. Orchard referred to as well as Jay. So certainly that is an option to any and all primary care providers that I would come out and or one of my colleagues and provide that sort of walkthrough one-on-one assistance with anything getting you up and going so that we all start off on the right foot. So first I'll just quickly talk to the anaphylaxis piece. So just a basic reminder about anaphylaxis in general with all immunizations is that it's a rare event that occurs usually 1.3 episodes per million doses of any vaccine delivered. It involves at least 2 body systems, so obviously the skin, respiratory, GI, or circulatory system. We always inject epinephrine intramuscularly into the mid-anterior lateral aspect of the thigh, and we do that by your 0.01 milligrams per kilogram weight. We no longer use diphenhydramine. Antihistamines, first generation or second generation, don't need to be administered as an adjuvant therapy. It actually can mask the symptoms of anaphylaxis, so your one and only choice of medication in an anaphylactic situation should be epinephrine. This is a simple dosing chart that I modified but mainly took from the Canadian Immunization Guide. It's an amazing resource for any and all of you. I've also been providing this in offices if they wanted to copy mine, so that you have a clear dosing chart on what to expect based on weight and the proper dosing from an ampule of epinephrine. This is also taken from the Canadian Immunization Guide, just a quick reminder of what should be in your anaphylaxis kits. I know that you all probably have bits and pieces of it in your office, but it's handy to have in one concise spot in case that rare event did occur, that you're ready to grab the equipment that you need. So it lists sort of the recommended items, but what's essential to have in some sort of container close by, and then some of the optional things that are then in your office on a regular basis. So just reminding that the clear message, you have at least 3 ampules of epinephrine and that you have 1 cc syringes with several gauge needles for administering based on weight and depth of your IM injection. Then I was quickly asked to mention a few things about vaccine storage and handling. So all of this also is gone over when we talk one-on-one on the phone when you start that onboarding process. So you're reminded of it a few times. It's also in the readiness checklist, which we'll quickly review on one of these slides as well. But just that you always need to have your vaccine approved and inspected fridge, and that if possible, you have a battery backup on that fridge. That isn't a mandatory request at this time, but if you're looking to house any more than 100 doses of the COVID vaccine in your fridge, it is required from the ministry. And then just a reminder that the transportation of AstraZeneca vaccine that you're picking up from either the Woodstock site or the St. Thomas site is that it's transported properly in an approved container with a max-min thermometer, a digital max-min thermometer, and it's maintained between 2 and 8 degrees. This is a bit more specific to AstraZeneca. So as Dr. Orchard mentioned, the vial once opened is good for 48 hours. So the first puncture, you put the time and date on your vial, and it's good in the fridge from 2 to 8 degrees for 48 hours. However, it's only good for 6 hours at room temperature. And then there's just a little caveat there about that cumulative time at room temperature and in the fridge. Oh, and I was also asked to just mention about the medical directive. So each primary care site would need to have their own medical directive. We at Southwestern Public Health have a medical directive. The Chief Medical Officer of Ontario also provided a medical directive to which many providers fall under. So this is just a glimpse at sort of the main things that are documented within our Southwestern Public Health medical directive that you may want to start to think about when administering COVID vaccines in your office. This is the last slide, I believe, and it's just about the readiness checklist. So for those offices that are up and going, you received this from me via email, just a document that I put together that sort of walks you through step by step how we get started, what's expected, and the things you need to pre-plan or think about in your office, as well as links to all the relevant information to AstraZeneca, including the product monograph, all the ministry documents, aftercare sheets, relevant information for patients and healthcare providers directly linked to the ministry website.